Gracious Heavenly Father, we just want to thank you for enabling us to and for enjoying the message that you have packaged. Lord, even as we listen, we open our hearts that you can be able to feed us. And at the end of the day, we continue going home praising and glorifying your name, saying that it has been good to be in this grounds of worship. Thank you, Father, for hearing us. For it's in Jesus' name we pray and believe. Yes, karibuni sana for the afternoon session. And we are now entering into very important aspects of our spiritual life, and that is on matters of health. I think Mary Nyamongo normally has the slogan that is to be spiritual is to be health. And to be health, for those who belong to Mary Nyamongo's club, to be spiritual is to be, and to be healthy? Yes, so to be healthy is part of our worship. So karibuni, and to take us through this session, we have Dr. Musa Mlongo, who has a long experience in this field, and we thank God that he has had time to be with us here and to take us through this session. Dr. Musa, thank you.
My name is Mlongo, as you have heard. I will say a few things to set the stage for this discussion. Firstly, I thank God that I'm here, and I'm here to have this discussion with you. Secondly, I'm an Adventist in good and regular standing, a husband of one wife and one 3-year-old child. I'm a member of a church in Canada called Ottawa SD Adventist Church. I will bring my name this way soon. I've just come back recently. So I am talking as one of you. I'm not talking about sophistry and crazy scientific theories that are not grounded in the Word of God. And that's how I would like us to look at this discussion. 2, I am not a doctor. I don't treat people. I'm not a physician. I'm a scientist. I'm an immunologist in training. My training is in making vaccines and testing them and taking them through licensing. I have done some work on human vaccines. I've done some work on animal vaccines. I'm a COVID survivor. I am a survivor, not just a COVID survivor, but a survivor of severe COVID. And I spent 17 days at Nairobi Hospital, and I wrote my will during that experience. So then the last point I have to make is that those who take, Sister White says, those who take the written word as their counselor will find in science an aid to doing what? To understanding gods. That is in Patriarchs and Prophets, page 115 and 116. That those of us who take the written word as our counselor will find in science an aid to understanding God. And that is how I do my science. That's how I understand my science. And my scientific understanding is grounded in creation. The earth was created in 6 days, and on the 7th day, God rested. And so I'm not approaching any of my science through the lens of evolution and stuff like that. I have learned about it. They have talked about it in school. But I'm well grounded in our faith around this. So let me get straight to the point. So first, I'm going to tell you that infectious diseases that cause pestilences and pandemics are as old as recorded history, and most of them have been a result of animal sources. Second thing I'm going to tell you is that vaccines are the most important discovery of modern medicine. And you will tell me whether you agree or not. I said most important discovery of modern medicine. I did not say don't exercise. I did not say don't eat healthy. I did not say you don't need sunshine. We have had those ones, and they are important for our health, maybe as important as vaccines, but I'm only saying that in the history of modern medicine, vaccines are the most important discovery based on the lives that they have saved. 3, Vaccines are mostly safe, and we'll discuss what I mean by mostly. And I look forward to that discussion, and are licensed after comprehensive safety assessment. 4, all COVID vaccines do not contain material from human fetal cell lines, and no abortions are happening now to harvest cells for vaccine production. I look forward to that discussion with you. And finally, we should do our best to protect ourselves and our loved ones, as the pandemic is going to be here for a while. I'd like to emphasize that last point. COVID-19 is not going away. It is here. If you don't get it this year, I promise you, you'll get it next year or the following one or the following one. We must all get it. That is what a pandemic is. It's in our population. It's going to sit. It's going to be like malaria for us, like HIV in some cases, like flu, like whatever diseases that we have with ourselves. So please do not sit here thinking that the government will lock out COVID-19 in the current curfews that we have. This disease is here to stay for a long, long time. Okay? And that's important for us to understand. Don't think you are young, you will evade it. You are 20-something, you will live. If you get it, it will be with you even when you are 50. Probably COVID will be here, and 60 and 70. So let's just understand that. So quickly, I'll go through my presentation, but I will try to stay on what I think are the most important elements for our discussion today. This picture here, if you look at it when you have time to look at it, shows the history of pandemics from recorded history, many thousands of years until now. Some of the most important ones have been the Spanish flu that killed about 200 million people in Europe in the 15th century, 14th, I think 13th, 15th to 14th century. You have then the HIV/AIDS pandemic that is still raging, that has killed millions of people at the moment. And there is a long history there, and you can look at that footprint that I have shown there with few pandemics here and there, Ebola, MERS, Asian flu, all that, killing lots of people. And now we have the novel coronavirus that we call COVID-19. I just wanted to emphasize that there is nothing new about COVID-19. We are not any special. I think one thing that I'm struggling with just from logic is that people are behaving as if COVID-19, as if we are special, that other people in history have not suffered pestilences and pandemics and died. If you compare COVID-19 with other pandemics in history, this is small change. This is a game. If you look at the Spanish flu, if you look at the bubonic plague, the Black Death from 1347 to 1351, which came from, I think it was Yersinia pestis, a bacterium from mice. People were dropping everywhere. And if you look at pictures drawn around that time, you'll see those are the angels of death that they understood at that time. They didn't understand that this is a bacterium, and people were dying and dropping everywhere. So this is, COVID-19 is a little joke compared to the problems that we've had before around pandemics. And I think that we need to put this into perspective before we say that we are so special, someone has created a virus in the lab to come and finish us. Those guys in those years didn't do anything wrong. Okay? Nobody even knew how to make pathogens and viruses and mix them in the lab and experiment. It just came out of nature. We know what the Bible says about pandemics and pestilences, and we can talk about that. That's a separate topic. But I just wanted to put that into perspective. So where did COVID-19 come from? Frankly, I don't know. We are still investigating. There is a lot of politics surrounding the investigation of where COVID-19 came from. There is a mixture of politics, global interests, with the Chinese protecting their corner, and the Americans and the other groups wanting to say, no, you created this and all that stuff. The truth is that we do not know. However, what we can say is that COVID-19 is not a unique virus. It belongs to a family of other viruses. It is called coronavirus because it has a crown on its top, if you look at it. So corona, it means that it is a crowned virus. That's where the name comes from. So it comes from a family of crown viruses. It was firstly identified, the first human coronavirus was identified in 1965. It caused common cold. And now it's a big family of about 7 types that affect humans. And many other animals like bats, raccoons, and pangolins, all of them carry coronaviruses. Experts say that the SARS-CoV-2 virus, which is the COVID-19 virus, originated in bats, the same as SARS and MERS. And you can, if you look at your slides later on, SARS emerged around 2002. It's infected about 8,000 people, killed 700 people. It has very similar symptoms to COVID-19. MERS in Saudi Arabia 2012 killed about 800 people. It was brought under control. We have no evidence now that COVID-19 was made by man. So the thinking right now, the theory is that, I don't know if it is true, that it came from a market in Wuhan in China, where you have all these crazy pictures that I put up in your WhatsApp. When you get time, look at my presentation. You have all kinds of animals mixing together in a very dirty market with people walking around and buying things. And some of these have been gotten from the wild. Some of these animals, snakes, and all kinds of reptiles are there. That's what they eat. And it is theorized that that is where the virus came from. When you get infected by any pathogen, virus, parasite, the mosquito virus, the mosquito parasite, the parasite that causes malaria, that's the one I'm referring to as the mosquito, I'm sorry. You respond by producing antibodies, and your immune cells respond. Your immune cells do not respond to the whole parasite. It responds to particular protein patterns on the parasite. And each parasite has millions and thousands of protein patterns. So what we do when we make vaccines, essentially, is we take 1 or 2 or 3, whatever number of patterns that we have confirmed that your immune cells respond to, and we give it to you. And that pattern, we make sure it cannot cause disease in you, it cannot harm you, it is just seen as a pattern that should excite your immune response, your immune cells to respond and try to eliminate it. That's all. Okay? So essentially that's what vaccines do. We take a small part of the pathogen, or we kill the pathogen and inject it into you, and your cells respond to it. We call that the first response, primary response. And the idea is that when the real pathogen comes and infects you, the pattern that was seen before will be part of the real pathogen, okay? And then you will respond quicker and faster and clear the infection. It is what God created you with to protect you from infection. And I can assure you that if we did not have that system, you would not live beyond 2, 3, 4 years. So that's how vaccines work. So what we basically do is just take that piece, put it into you, make sure you do not get sick from it, and then wait for the real thing, and then respond faster to the real thing, because respond within 2 to 3, 4 days to the real thing, because memory is developed to that particular pattern that we put there. So when it comes to COVID, what the current vaccines against COVID-19 are really basically against a pattern of proteins on what we call the spike protein, on one of the crowns, one of the little pieces that one of the molecular patterns on the crown of the COVID-19 virus. And what people have basically done is identified a pattern that to which antibodies respond to, and then they have done a number of things that we'll talk about, and then they inject them into you, and you have an immune response, and then when the real virus comes, you are, as we call it, protected. That's it. So let's talk about a very important concept, really, really important, that not bad at all, a really important concept that, again, we need to understand. Because there's a lot of issues around RNA vaccines. It's the first time they're being used. They're very bad for us. They're going to change us into crocodiles and other living creatures, and we must be very, very careful. So I like using this very simple example of the plan for a house and the building of that house, the process of building that house. Thank you very much. You have had mercy on me. Thank you. The building of that house and the finished house, okay? So I want you to assume that all the instructions that make you as a person and make any living organisms, trees, whatever, are the plan of the what? Of the house. The plan says put the windows downstairs. They ought to look like this, like you've done here. Put glass windows, not wooden windows. There is another house that will put wooden windows and not glass windows. So that's our diversity. Basically, some of us are tall, some of us are short, some of us are a little bit plumpy, like me. Others are smaller. So that's how all that comes from our what? Our DNA, which gives all the instructions of everything that we are. Some people's DNA says malfunctions and they become blind because you are unable to construct the full functional eye based on the instructions that have come there, and say you are practically born blind. It's an example I'm giving you, okay? So DNA will assume is the plan for our house. Now, once you've planned the house, an architect had drawn it, you need an engineer to do what? To understand what the architect is saying. So you have structural engineers who come, who have been trained and who understand that when the architect says, draws this and says this is to proportion and this is 4 meters from here to here. So the engineer takes that up and does what? And starts to construct the house until it is complete. So basically, DNA keeps the plan of you and how you function, in fact, every day. And then you have RNA that translates what the plan is into a what? Into a protein. Okay? So the complete house is the protein. It's functional. It is what makes you live day to day. Are we good with that analogy? Yes. So the translator here in the middle is what? Is RNA. And the message, all the instructions sit in DNA, and the protein is this complete what? House that is functional. Your immune system responds to the protein. It doesn't respond to RNA. It doesn't respond to DNA. It only responds to your proteins, to the finished instruction. Okay? So what basically, so is this clear? If this is clear, then I'll go to the next point quickly and talk about the types of COVID vaccine that we have. So that takes me to the Moderna and Pfizer vaccines. They are basically RNA vaccines. It's the first time we are using RNA vaccines in humans. We have researched them from around 1995. And this is the first time that we are using them in humans. So the idea really is that, interestingly, and this is what you didn't know, is that you share some commonalities with the coronavirus. Your DNA is just arranged different from the COVID-19 virus DNA, okay? So if we take a little piece of the COVID-19 DNA and put it into you, you will actually process it to become a what? A protein, okay? But the protein will not be yours. It will be a foreign what? Protein. It is not yours. It has no work in your body. It is foreign. It doesn't fit. So that protein will incite your immune response. So you will respond to it because it is foreign. And our immune responses are designed to react to everything foreign. In fact, we use non-self. Anything that is not self, you have a response. And we can talk about food which is not self, and I can tell you that food is fine because everywhere as you eat, all the way through the alimentary canal, we call them immunologically privileged sites where you have a quiet immune response to keep you alive. But the point I'm making is that we can give you a COVID-19 sequence or instruction, and you will make what? You'll make antibodies to it, and you'll make the protein, and then you'll make antibodies to it. So going back quickly again, COVID-19 vaccines, RNA vaccines, this is basically the principle. You are being given RNA. You are not being given DNA. You are being given an instruction. Your body is being told, can you make the COVID-19 protein? And your body makes the COVID-19 protein, and you produce antibodies to it. And what happens is the antibodies bind to it. You have memory developed. Antibodies are produced by B cells. That's not the lesson for today. But you have memory developed. And next time you have the real COVID-19 virus, the antibodies that saw that protein will do what? Will fight it. What happens in viruses and other organisms is you can go back and forth between DNA and RNA. RNA can become DNA and DNA can become RNA. In humans, that never happens. So if we give you a COVID-19 RNA sequence or message, it will never get into your DNA. And this is where the politics of all these RNA vaccines has been sitting. What people are saying about RNA vaccines getting into you, being integrated into you, changing you, is scientifically impossible. Okay? So having said that, let me quickly go to, so the Pfizer and Moderna vaccines basically work as I've described, and then you have the AstraZeneca Oxford vaccine, whose approach is slightly different. What they have done is they have taken that same sequence, in that case, I think it is DNA that they have taken, and they have put it in a virus called adenovirus. And what is happening is the virus replicates and makes many copies of that little protein, and that is what you get injected with. Okay? So we say it is adenovirus vectored because it is, you must multiply those copies, and then we put them into you, and then it becomes a protein again. In fact, it's put into you while already translated into a protein tome, am I right? And then you respond to it, and then antibodies are produced, and it is all fine. So that's how it works. And there are many other ways of making vaccines, including just giving you killed vaccines, and then which we have confirmed that don't work very well. So most vaccines in the market right now, I'll talk about them quickly. You have the Pfizer-BioNTech vaccine for COVID-19. You have the Moderna vaccine. Those two are RNA vaccines, 2 doses, 90% effective for the Pfizer vaccine, 95% for the Moderna. When we say 90% effective, we are saying if we immunize 100 people, 90 of them will be protected. That's what we mean, okay? If we immunize 100 people, 95 of them will be vaccinated. And then you have the Oxford AstraZeneca vaccine, and then you have Sputnik from Russia, and then you have Sinopharm from China that I've not added to this list. So I will quickly go to the goal of vaccination. Good, I'll finish in about 5 minutes, and then we can have a discussion. Why do we vaccinate specifically for COVID-19? One, we are vaccinating to reduce the development of severe clinical signs. We vaccinate to help you reduce the severity of your clinical signs. We do not vaccinate so that you do not get COVID-19. Okay? But we vaccinate so that you have reduced severity of the illness. Two, we vaccinate you so that the length of time that you take between catching the virus and recovering is reduced. So if I spent 17 days in the hospital, I was not vaccinated then. If I had been vaccinated, maybe I would have spent 5 to 6 days at all if I would have gotten to the hospital. We vaccinate to reduce the likelihood for hospitalization. We vaccinate to reduce the likelihood of death. And we vaccinate to reduce the likelihood of infecting others. And I will show you the graph for Israel where the drop in cases of COVID-19 were consistent with vaccination. So we know that if we vaccinate many, many people, you start reducing the spread of the disease because you have people staying with it for a shorter time, showing less severe symptoms, and therefore reducing the overall burden of the disease in our population. Vaccination does not stop the virus from entering your nose and mouth and staying there for a short while. 2, vaccination does not stop you from infecting someone else. Maybe the people who you come in contact with are at reduced risk because you're vaccinated, because you have a lower viral load, as we put it, but it does not necessarily stop you from infecting someone else. And vaccination does not stop you from getting sick from a new variant. And we'll talk about the Delta variant. You guys have heard of the Delta variant. And reduce it. But while vaccination might not protect you from a new variant, it will reduce the likelihood of severe disease from the new variant. Now that I've talked about the new variant, I'm jumping here so that I can talk about variants and take care of that slide. So you have basically 1, 2, 3, 4 variants. And what we mean by variants quickly is that you guys know what we mean by, all of you, if you went to primary school and secondary school, you heard about the lock and key hypothesis, did you? In biology. Structure, function, lock, and key. So that just means that when we talk about biochemistry and interaction of biology and pathogens and things like that, what we are really talking about is molecular patterns binding to each other, okay? One is the lock, the other one is the key. So when we have a pandemic like COVID-19, what happens is that viruses keep on changing or mutating, you must have heard. And the basis of that changing is to try to avoid your antibody responses. So what happens is this becomes a race and a game where we give you this pattern that we know your antibodies will respond to. But what happens is that as the virus spreads in the population, it starts realizing that there is a pattern of antibodies I should avoid, okay? And what it does is that it starts to change a few elements of that pattern, and when you have the infection, your antibodies do not bind properly. It's just like when you have your key, you go to your door, your key is getting old, and it just can't open. It fits in, but the door can't do what? Can't open, because the pattern has slightly what? Changed. And that's what mutations and viruses really are. And that's what we call variants. Variants are basically padlocks that have changed a little bit because the key that we developed to it, either the padlock has changed or the key has changed. I'm not sure I'm doing this analogy correctly, but you get the point. It is a slight change in the molecular pattern of the parent virus that is going to infect you. So we vaccinate you against A, but it just changes a little bit and becomes, the pattern becomes almost like pattern B, but we gave you the key to A, right? And then we can't quite open the lock. But remember that because you're vaccinated, we know that that key could get in there. If you spend a long time there, okay, you might just get the padlock to do what? To open. So that's really the concept of variants. So we have 1, 2, 3, 4 variants right now. The worst is the Delta variant at the moment. And currently, the information we have is that the Johnson & Johnson vaccine, the Pfizer vaccine, the Moderna vaccine provide a range of immunity to the Delta variant, 67%, and then between 62 and 95% depending on the person, and between 42 and 96% depending on the other person if it is Moderna vaccine. So basically what we are saying is that you are still protected if you are vaccinated against the COVID-19 virus that for which we have existing vaccines. We don't have a vaccine specifically for the Delta variant, but the Delta variant might also do what? Protect you. So quickly then, this is the picture in Israel. They started vaccination in December 2020 when cases were soaring and going very high. And by April 2021, you had very, very much lower cases, around 1,000 actually in the lab, coming down from 10,000. I'll have to look at the scale and understand, but you can see the picture. You had rising cases, you had extensive vaccination of people in Israel, and you started having a drop of COVID-19 in the population. And right now with the Delta variant, if you look at information coming out of Israel, vaccinated people are having better outcomes than unvaccinated people. Good. So let's quickly deal with the question of vaccine safety. Are vaccines safe? How many think vaccines are safe? Okay. How many think vaccines are not safe? So these church people have no opinion. You just go with the wind. How many people, now on a serious note, how many people actually, don't try to please me, really, what you believe. How many people think vaccines are safe? Okay, fine. How many people think vaccines are not safe? Great. How many people think some vaccines are not safe? Okay, good. So, the simple answer is that vaccines are safe, the ones licensed for majority of people. Okay? For majority of people. Modern science is limited in predicting who will be safe or not safe. We have honestly no way of telling, except we can just say, just like we say for some drugs, don't give this to pregnant mothers, it might harm them. People older than 90, don't give them this drug. That's all we can say based on testing and evidence. But at the moment, vaccines, and COVID vaccines specifically, are safe for the majority of people. And we have no way, I repeat, no way of telling who the vaccine will harm and who will not. And I'll go through a few of the side effects. Okay? And before we talk about that, let's just quickly remind ourselves how we get a vaccine licensed and put into our arms. We go through a long process. We test things in mice, we test things in rabbits, we test things in guinea pigs. We go to healthy humans, then we go to the whole population, and at each time we look at the safety of whatever we are putting into people. And we have what we call phase 1 clinical trial, then phase 2, then phase 3. Phase 3 is many people, hundreds of thousands, different races, all age groups. Phase 2 is a smaller number of people. Phase 1 is a very small number of healthy people. And what we do is we gather information on the safety and performance and effectiveness of this product. And if you are happy and convinced the people who license vaccines that your product is safe, then you get licensed. Nobody has made a vaccine in the lab and come straight away and said, I want to put it into your arm. So we go through a process, and what happens is that if the majority of people are not harmed by the product, it is licensed. Okay? So we use, and there are 3 measures basically that are used. One is that we use the number of people that are protected. We use the number of people showing side effects, whether they are mild or severe, we classify them. And then we look at the number of people showing reactions with or without existing medical conditions. So we do a probability calculation and say this seems to be safe for the greatest number of people, and that is how we conclude that we can use a particular vaccine. For the current COVID-19 vaccines that we know, we have 3 main side effects that are recorded. You have the formation of blood clots, we call that thrombosis. The Pfizer vaccine produces that. And the Johnson & Johnson vaccine causes blood clots. The Oxford AstraZeneca vaccine causes blood clots. Moderna vaccine has been recorded to cause blood clots. That is the sad news. But the good news we should ask ourselves is, how many people had these blood clots? The Pfizer, I don't have the data. The Johnson & Johnson, the people who have been recorded to have blood clots, at the time I got this data, which is about 2 weeks ago, 44 people out of 14 million people, which is 0.0004%. Okay? For the Oxford AstraZeneca vaccine, 219 people out of 34 million people who got the vaccine, 219 showed the blood clots. And for the Moderna vaccine, 2 people out of 346 million people had the blood clots. Then there is a nerve damage caused by specifically the Johnson & Johnson vaccine. It has been shown in 157 people out of 14 million people. That is, and all of them in men over 50. So, which is an incident of 0.000125%. And then you have another effect, heart inflammation, caused by the Pfizer vaccine, caused by the Oxford AstraZeneca vaccine, caused by the Moderna vaccine. And the number of people is 1,339, mostly young men under 30, have shown inflammation of the heart that has gone on to heal, out of millions of those who have been vaccinated. What about death? How many people have died after getting a COVID-19 vaccine? To date, 6,968 people have died in the US out of 369 million people who have been vaccinated, which is 0.00019% of the people who are vaccinated. For the people who have died after receiving a COVID-19 vaccine, we do not know whether they died because they had received the COVID-19 vaccine. We have not shown a clear association between those deaths and COVID-19 vaccine. We know for sure that the blood clots have killed some people. That is true, but quite a small number of people. However, for these 6,968 deaths, we do not know whether, we cannot show that the death was caused by the vaccine. Okay? It's just like saying, out of 10 million Kenyans that ate beans this morning, 5 died. Can we say that the beans caused the deaths? Unless we investigate, we do not know. So that's what I'm saying. So I'd like to leave it at that so that you can ask a few questions. There is one last point I want to touch very quickly that I think is important. People have talked about the relationship between abortion and COVID-19 vaccine production. And people have made claims that some people are causing abortions so that they can get cells to produce the COVID-19 vaccine. Very quickly, there are 2 types of human fetal cells that have been used to produce, especially the AstraZeneca vaccine and the Johnson & Johnson vaccine. But let us look at the history of these fetal cell lines. So these were obtained around between 1960 and 1975, and they were obtained from aborted fetuses or elective abortions. Medically aborted fetuses or people who chose that they wanted to abort. And there are 2 types of cell lines. One is human embryonic kidney 293. They came from a kidney of an aborted fetus, human fetus. And the other one is called PAR-C6. It came from the eyes of an aborted fetus in 1985. These lines, we call them cell lines because we produce them in the lab and we keep them alive for a long time. We freeze them, and because they are embryonic cells, they divide, okay? They divide continuously, so we can count them, freeze a few thaw them, use them, and then put them back again. They are easy to use. And scientists basically have used them in experiments by infecting them with viruses and looking how the viruses will behave. And that is part of the whole process of developing vaccines. If you have had the MMR vaccine, and I'm sure you all have had it, yes? The measles, rubella, and I think one more vaccine, the one that our kids have, some of them have been used to, some of these cells have been used to produce the rubella vaccine, the rabies vaccine, the hepatitis vaccines. When we say used to produce, it does not mean that you have bits and pieces of an aborted fetus that has been injected in you. It just means that the cells were taken, the original cells that were picked in 1960, they have been propagated and they grow and grow and grow and grow to the extent that they just become almost an ordinary lab reagent, okay? And then you stick in the viruses, they grow there, and then you take out your vaccine from there and purify it. It has nothing to do with the fetal cells. So while the Pfizer and Moderna vaccine has used fetal cell lines to study COVID-19 virus, the cells were never used to produce the vaccine, and no material from the fetal cell lines is in the vaccine. That's important for you to know. The Oxford and AstraZeneca vaccine and the Johnson & Johnson vaccine have been produced in virus that was grown in HEX 293 cells, then isolated from these cells, and the vaccines do not contain any material from the fetal cell lines. I'd like to finish by quickly saying, I will not ask on your behalf, but we can discuss this in the next few minutes remaining. What are the new COVID-19 variants, and can vaccines protect us from these variants? I've answered that. Why have COVID vaccines been developed so quickly compared to vaccines for other diseases? We can talk about that. Will people who have been vaccinated against COVID-19 die after 2 years? How many have seen that online? Yes, I got that email from a friend recently. I was vaccinated in May against COVID-19 again, although I didn't need to because I had recovered, but I took it for travel purposes. I took the Pfizer RNA vaccine, and I doubt that I will die in 2 years. So I think that we should discuss that too. And can I still get sick after being vaccinated against COVID-19? A little, probably, if at all. So I have told you that infectious diseases that cause pestilences and pandemics are as old as recorded history, and most of them are a result of animal sources. I've told you also that vaccines are the most important discovery of modern medicine. I've told you that vaccines are mostly safe and are licensed after comprehensive safety assessment. I've also told you that no COVID vaccine contains any pieces of material from human fetal cells, and there are no current abortions going on to produce human fetal cells for vaccine production. And finally, we should do our best to protect ourselves and others because this pandemic is going to be around for a while. Thank you. Wow. You gave me up to 3:20. It's 3 minutes to 3:20. Pastor. Okay. Let's leave it at that. I don't know if we have any burning questions, and I think Pastor will not be unhappy if we take 8-9 minutes more instead of the 3. Yes. I don't know who is moderating now. Elder probably should moderate. I don't want to be the one.
Thank you. Thank you, Dr. Moses, for taking us through that session. It was very interesting. And maybe I'll ask you my question because I raised my hand first. Of late, we are seeing the area like, okay, vaccine related to polio. Vaccine related? Polio. Polio. Yes. We are seeing quite a high rate of failure from the previous vaccination. You would see that, that there is an announcement, chiefs put under order that all kids under 5 years in your locality, they should be revaccinated again. And yet they were vaccinated earlier. Why should this huge failure that warranting again revaccination? You know, there is debate around there that perhaps And given that there are certain localities, some companies give it as a donation, and they allow this vaccination to take place, and later on, only to find that the probability failures, that is step one of testing. I don't know. Maybe you could shed more light on that. And then one more question, all right?
Good afternoon. I have actually two questions. My first question is this. As the data was coming in right from around last year, I understand that we are counting people dying with coronavirus and from coronavirus the same. Was this justified, and how much has it affected the data? And there's a technique called p-hacking in statistics. I understand it came up because there's a dissonance between scientific research and economic incentives. And how much has this been affected in the development of the COVID-19 vaccine? The second question is this. The vaccines that are being used, I'll take the example of the US, they've been approved under the emergency use authorization. But recently, there's a vaccine called Comirnaty. I believe it's still under the Pfizer company, which has been approved by the FDA. But reading the document, they say that there's no difference between Comirnaty and Pfizer. I'm a legal trainee, and I understand that an approval and emergency use authorization have certain effects when it comes to legal liabilities. Why did the US government choose this approach? Thank you.
Thank you.
I will advise that if you have any questions, you write them on your pieces of paper, and then we'll collect. We'll allow Daktari to respond to them and communicate the answers through our chair for the CAM meeting, just to save on time. I'll allow Daktari to answer these three questions. If you have additional questions, there's a young man who was vaccinated here in church. We support vaccination. We actually brought the vaccinator here, and he developed hives on his skin. He had skin eruption, but it was treated. So he came to me and asked me,
Okay. Yeah.
he came and asked me, Daktari, is this because of the vaccine? He had a skin reaction to it. I don't know whether he's here today, but yes, he's there. So you can talk to him when we finish, right? So have a conversation
I'm not a
with
medical
him.
doctor, but quickly, to the question of polio vaccines, I have to look at the literature. I can't answer it offhand. However, I did work before on why African children do not respond well to oral vaccines. I believe that the polio vaccine is oral, isn't it? Yes. So depending on the locality and where this is being seen, I don't think that it is everywhere. Kids who grow up in slums and poor areas, if you go to Kilifi, that's a big problem. If you go to Kibera here, Mathare, they have a lot of gut inflammation, which causes malabsorption of vaccines. It's a big problem. It is seen in polio. It is seen in Shigella vaccines. It is seen in rotavirus vaccines. All the oral vaccines, our kids just don't respond well to them if they are malnourished and live in a poor setting with high disease burden. That is one possible reason why maybe you would need to revaccinate. But Elder, I will do my research on that specific one and get back to you. The second point I want to say quickly is that vaccines don't make as much money as we think. In fact, if you were to ask companies to choose between making vaccines and making drugs, they will make drugs, because vaccines protect us to some extent for a lifetime, and there is nothing attractive about giving you something that will protect you for a lifetime. That's why we have financially. That's why we have antibiotics everywhere. We have all these other kinds of drugs that we use. There is no major advantage of making vaccines. That's why you look at vaccines for Africa, we struggle to afford them. We have a lot of help from the Gates Foundation and others for us to afford childhood vaccination, because they are They are very expensive. Companies, if they were to make them and make money out of them and sell them to us as African countries, we would not afford. That does not mean to say that companies don't want to make money from vaccines. COVID vaccines are very attractive. It's a big pandemic globally. People want it. Government wants it. We want to open up. Of course, companies are doing their best to make money out of COVID vaccines for a fact, and that is true. So coming back to the questions that you asked, firstly, of course, if you talk about data and statistics, it's a mess, okay? There's a big difference between dying from COVID-19 and dying when you have COVID-19. If you come out here and you are hit by a vehicle this evening and you had COVID-19, you did not show symptoms and you are taken to Kenyatta Hospital in the mortuary and they test you, they will say someone might say you have died of COVID-19. So I don't think that the public health authorities, in fact, globally, were able to make this distinction properly, and this caused a lot of confusion. I personally believe that COVID deaths were, earlier on, were slightly less than what was being reported. That's one. And then you talked about an approach, p-hacking. Tom, do you know anything about p-hacking? I have no idea. Yeah, I haven't heard of that particular approach. However, let me quickly say that, just come back to the emergency authorization. So for all of us here, please let us all understand that the pandemic is new. We don't have enough information. You guys are asking us to get a solution for you, and we are doing our best to get a solution for you based on what we know. There is a lot we don't know about the virus. There is a lot we don't know about the vaccines. Our focus now is to try to reduce the spread of the virus and also to have people become less sick from this virus. That's the only focus. And the math that is done right now, the cost-benefit analysis that is done now is to say, what is better? Do we let the vaccine spread and let people develop natural immunity with a big number of people dying anyway, okay? And life continues, or do we try to get something that can protect them, even if we do not have enough information about that thing that could protect them? And so the vote has gone on the side of, let's get something that can do what? That can help them for now, based on the current knowledge that we have. That is all. That's the decision that is made. It is a cost-benefit analysis of, we want to save as many people as possible, as quickly as possible, and that is why we are doing what? We are using the approach of vaccination. Okay? Thank you. I'd like to leave it at that so that the program can run. I have no intention of taking your whole afternoon talking about this very boring stuff.
Thank you very much. We are very educated. Can we clap for our visitor, please? Thank you, Daktari. Let me ask, how many of us here have been vaccinated? Let me see a show of hand. And so, if you have not been vaccinated, after you've heard what Daktari has said, there was data from which hospital? Metropolitan. And the people who were in ICU were those who had not been fully vaccinated or had one vaccine. You will not walk without protecting yourselves. We actually brought a vaccinator here, and she went away with some of the vaccines because the turnout was very low.
Can I say something very quickly?
Yes, please.
I am 44 years old. COVID was the most severe infection I've ever had. And I am not the same after recovery. I need you to understand, I'm not the same guy who went to Nairobi Hospital. My chest tightens anytime it feels like. I put on a mask, go into the supermarket or the mall. I can't use it for more than 20, 25 minutes. My chest pains when it wants. It stops when it wants. It happens 3-4 hours a day, 1 hour a day, sometimes none. I run, I exercise, I keep fit, I lift weights, I run. I am good. I can run 6 kilometers today. That doesn't mean that my chest doesn't hurt at certain times. So the point I'm making is that this disease does not leave you the way you were. Yeah. And so if you can get vaccinated, you'll probably have a better outcome, you'll probably heal faster, you'll probably survive it and not get hospitalized. If you can do that and there's a vaccine available, please go for it. Thank you.
Thank you very much for saying that. Pastor actually had asked if we can bring a vaccinator here. The only reason we didn't is because when we brought a vaccinator upstairs, it was specifically for us. Even our students didn't show up. So if there was vaccine hesitancy, which is a problem we are dealing with globally, please, I hope this afternoon has changed your mind. Let us know how many of you want to be vaccinated. We can try and see whether we can get somebody to come here and vaccinate you. On the question of polio, from a social science perspective, when you see them doing rounds of polio vaccination, there's an outbreak somewhere. So if there's an outbreak even in Nigeria, they would ramp up the campaigns in the African continent. So whenever you hear vaccinate, vaccinate, from a social perspective, there is already an outbreak, and they are trying to prevent the escalation of those outbreaks. Thank you so much, Daktari, and we continue to pray that God continues to heal you, and we'll call you again to talk to us. I have asked you if you have any questions, please note them, give me the pieces of paper, we'll hand them to Daktari, and he can respond and we'll send you the comments. May God bless you. Thank you very much.